All right, so our group is talking about croup. Next slide. So I'm going to be talking about the clinical manifestations and talking about the pathophysiology of croup. Liv is doing potential issues, and Mel is talking about nursing interventions. Next slide. So we have our patient Rory Smith. He's a 3-year-old boy born in the 4th of June, 2019. Rory was presented to the hospital by his mom and dad past midnight at 15 past 1 with a fever and a harsh barking cough. He's also had runny nose for 2 days now. And according to Rory's mom, Rory was coughing earlier, but it's gotten worse overnight. Rory is 38 weeks gestation, and he spent 1 week in NICU post-vaginal birth with chest infection. Past medical history, no known allergies. He's up to date with his immunizations and asthma and eczema. In terms of Rory's social life, he attends daycare twice a week, and he's friendly and an active child. Rory's vital signs are down below. So his temperature is 38.9, blood pressure is 90/53, pulse is 118 beats per minute, respiratory rate is 26 beats per minute, oxygen levels is 96% on room air. Next slide.
I'm doing the pathophysiology. So we begin with the upper respiratory system, which includes the nose, mouth, and throat, which we breathe through. And then oxygen travels down to the lower respiratory system, which includes the larynx and trachea, which then lead to the bronchioles. Illnesses such as bacterial or viral infection, like influenza or bronchiolitis, can lead to laryngeal tracheal bronchitis, and that's otherwise known as croup. Bacterial infection is less likely to cause croup over viral, but it's still possible. A child who presents with croup normally has an upper respiratory infection or cold for a few days prior to developing croup, which Rory has had. Croup occurs when the virus moves to the lower respiratory system, causing an inflammatory response to the larynx and the trachea. The swelling causes an increased mucus, pain, and edema, causing the airway to narrow, which then leads to an increased work of breathing and stridor. Croup can also be worse at night due to a cold air and can be worse when a child is distressed. This swelling to the larynx and trachea in children is dangerous as their airway anatomy is narrower than adults and can be obstructed quite easily. When a child becomes distressed, this stridor and work of breathing becomes worse and can become life-threatening due to the difficulty of air to pass through. Stridor is a noise that is made by the airway as air is trying to pass through the larynx, which is narrowed and obstructed, and it is heard as a high-pitched whistling. So croup can come in different forms. It can be classified as mild, moderate, or severe. Mild is classified by a barking cough, but no stridor at rest. Moderate has an increased work of breathing with retraction, tachypnea, and tachycardia, as well as an audible stridor at rest and worsening agitation. Severe is a significant respiratory distress and may also have an altered mental status. The lack of stridor can be present or won't be present due to respiratory obstruction and limited air movement. At 3, for developmental milestones, Rory should be able to play independently as well with other children. He should be able to play with blocks and stack them, interact with adults and imitate them, and is mostly toilet trained. Rory should also be able to be independent with his dressing and undressing himself. And at 3, they love to ask a lot of what and why questions as they learn. Some red flags for Rory at 3 may be him not wanting to play with other children, multiple falls and difficulty with walking up and down stairs, not being able to follow instructions, difficulty with his speech or being able to use his fine motor skills like picking up crayons to draw or stacking blocks, He may, if he has any of these or more, he may be struggling with, discussion should be done with the parents and the paediatrician. Next slide.
So some potential issues Rory may be facing. The first one is that he's developed stridor on inspiration. Children suffering from croup often develop stridor on inspiration as the viral infection causes inflammation and narrowing of the larynx and/or trachea. This can cause distress to Rory and his parents as he may have difficulty breathing. The goal for this issue would be to educate Rory's parents on what stridor is, how it can be managed at home, and when to present to hospital. By doing this, Rory avoids becoming distressed when presenting to hospital. The second issue he's facing is having a high temperature of 38.9. Rory has developed a fever of 38.9 whilst he's unwell with croup. Running a high temperature is a common symptom of croup as the immune system produces more white blood cells to fight an infection, heating up the body and causing a fever. While fevers are rarely harmful, high temperatures in children may cause febrile convulsions or seizures, which is a concern for Rory given his age. So the goal for this would be to reduce Rory's temperature and prevent him from having febrile convulsions. Reassure Rory's parents that a high temperature is a common symptom of croup and is rarely harmful, but also make them aware of what can happen if the temperature is elevated for prolonged periods of time. The third issue Rory's facing is difficulty swallowing and dehydration. So due to the narrowing of the larynx and trachea, Rory may have difficulty swallowing liquids and is at risk of becoming dehydrated. So the goal would be to encourage water and hydrolyte, especially after any steroidal medications, and trying to avoid inserting an IV as it may cause more distress for him. Next slide.
You're muted, Mel.
Sorry. I'm doing the nursing interventions. So as croup is a symptom of a viral infection, Rory is also presenting with a high fever of 38.9 degrees Celsius, which is common in children presenting with this severe illness. The goal is to avoid his presentation on becoming severe and worsening, so fluids may be encouraged to ensure he stays hydrated, as lots of fluids may be lost due to his rapid respiratory rate and fever. If fluids orally may be discouraged from drinking as a result from his difficulty of breathing and narrowing his airways, IV fluids may be more suitable to stabilize his hydration levels. Although, depending on the patient and how distressed they appear, in some cases, inserting an IV cannula for fluids may elevate and increase the baby's distress. In this instance, oral fluids combined with hydrolyte may be encouraged to stabilize the patient's hydration levels. During Rory's hospitalization, it's crucial to monitor his temperature regularly and to evaluate the effectiveness of his response to treatment and nursing care. Children like Rory will be able to treat his fever with over-the-counter medications such as ibuprofen or paracetamol. Antibiotics and B-lactams are not required to treat these types of fevers, as croup is caused by viruses and not infections. However, croup can be contagious. So in the first few days, it's crucial that nurses perform good hand hygiene and try to prevent cross-contamination where possible. Another concerning issue Rory is presenting with is difficulty breathing, which is also reflected in his vital signs, as he has a high respiratory rate of 27 and a low oxygen saturation of 96. As the goal for Rory during his hospitalization is to decrease the inflammation, which will allow him to breathe easier and to improve his oxygen intake. Clinical manifestations that support the fact Rory is in respiratory distress is his inspiratory stridor, at rest, and increased work of breathing. The nursing care team should perform a focused respiratory assessment on Rory by auscultating his lungs and evaluate his work of breathing, as well as monitor his oxygen saturations. By documenting these findings will allow nursing staff to evaluate his response to treatment as well as monitor any trends or patterns that may be evident. Simple nursing interventions may apply to help assist Rory with breathing, is repositioning him to avoid airway obstruction or even to apply oxygen to assist with his oxygen intake. By referring to the evidence that Rory is in respiratory distress, we can see that he's presenting as hypoxia or using his accessory muscles during his work of breathing. The nursing team will be able to assess the situation and calculate which pharmacology treatments are suitable to assist the nursing interventions. As his stridor is severe at rest, an adrenaline nebulizer is used to help decrease inflammation or open the airways to allow him to breathe with ease. Steroids such as dexamethasone may also be used in combination with nebulizer. This will likely to also decrease the inflammation on his airways. Whether or not his breathing has improved, he may be kept on the anti-inflammatory medications, and if his condition deteriorates further, he will receive a NICU or ICU review. Although this is a scary situation for both baby and the parents, it's important to keep the children with their carers at all times to avoid further distress and anxiety to the patient. As this is a very stressful time for both patient and parents, reassurance and patient education may be provided to the family to explain what's currently happening and why. The teach-back method may be used on discharge to confirm with his carers that they understand the health advice care and for when they go home, as well as what to do if an event like this occurs in the future. With all these nursing interventions alongside pharmacological treatments, we will aim to help improve his concerns and work towards the goal of recovering from his current diagnosis of croup. Next slide. So these are some of the references we use to gather all of our information. Next slide. Next slide. So by understanding the pathophysiology of croup and the clinical manifestations that Rory is presenting in this case study, we are able to identify the rational goals and how to apply nursing interventions in combination of pharmacological treatments to get a positive health outcome for Rory. So altogether, we are able to see how he's able to recover and to continue growing up through life. So yeah, thank you so much for watching. Yeah, bye.